I am Dr. Amarta Sankar Chowdhury. I'm an endocrinologist. I treat patients who are suffering from diabetes, thyroid disorders, and other metabolic and hormonal diseases. Now, I'll be discussing a few points with diabetes regarding diabetes because today we are observing World Diabetes Day, this 14th of November. It has been almost 2 years now that we are fighting with the global pandemic of COVID-19. And thanks to the widespread vaccination and other safety measures, we have been able to lower the severity of disease. However, another important pandemic which we need to consider very seriously is the diabetes mellitus. That is, people having high blood glucose. Now, globally, there are almost more than 400 million adults who are living with diabetes, and the prevalence of diabetes has nearly doubled since 1980s. And unfortunately, a large number of people are moving around in an undiagnosed diabetes. They might be having diabetes, but they are still unaware of the disease. Now, this is related to increase in risk factors, obesity, overweight, lack of physical activity, and such things. The worrisome part is that the prevalence of diabetes is higher in the lower and the middle income countries. And these are the countries which have limited access to healthcare and the healthcare benefits. Now, we all know diabetes is a major cause of heart attack, stroke, kidney failure, blindness, as well as lower limb amputation. Therefore, it becomes very important to diagnose this disease as early as possible, treat this disease effectively so that we can prevent these life-threatening complications of this disease. Now, 14th of November each year worldwide, we observe the World Diabetes Day. It will be inappropriate to say that we celebrate this day because we cannot celebrate the sufferings of so many people who are living with diabetes. This day, we observe this increase the screening program to detect diabetes, especially those who are at high risk of developing this disease, so that we can diagnose it early, treat them early, and prevent any complications which can be related to diabetes. Now, this year, the theme for World Diabetes Day 2021 is access to healthcare. As I've already mentioned, the prevalence of diabetes is increasing or is very high in low and middle income countries. And these are the countries which have very poor access to healthcare. They do not have access to blood glucose testing, investigations, treatment, and insulin. And it becomes very important on our part, on everybody's part, to strive forward to make things, to do some things for these countries or these people so that diabetes treatment can become easily accessible to one and all so that everybody can live a life which is free of complications of diabetes. Now, we are celebrating almost 100 years of insulin discovery, which was by Benting and Best. Now, this was a remarkable event in the history of diabetes because as we all know, people who are suffering from type 1 diabetes, who are completely insulin deficient, need insulin for survival. And if insulin was not there, these people would not have survived beyond a few days, which was there before the invention or discovery of insulin. Now, we have had almost 100 years since the discovery of insulin, but unfortunately, we still have a long way to go to prevent or to control this disease burden so that we can reduce the burden of the disease, the healthcare, as well as the economic burden which the patient and the family faces when they suffer from this disease. Now, coming to the basics of the disease, it is basically a chronic disease where the pancreas is the gland which produces insulin. In diabetes, the pancreas does not produce enough insulin, or the insulin which is produced by the pancreas is ineffective. Broadly, we have three different types of diabetes. One is the type 1 diabetes, where the patient is completely insulin deficient. They need insulin to survive. They cannot stop insulin for even one day. If they stop insulin for even one day, they might end up with life-threatening complication, which is known as diabetic ketoacidosis. Now, patients who are suffering from type 1 diabetes, my earnest request to them is that they should never stop insulin. Do not believe or fall prey to any rumors or myths who can suggest a magic cure for type 1 diabetes. As of now, insulin is the only treatment for type 1 diabetes. And if you're suffering from type 1 diabetes, if you have been diagnosed as type 1 diabetes by your physician, by your endocrinologist, do not stop insulin. The other major type of diabetes is the type 2 diabetes, which is the most common diabetes which we are dealing with. And whenever we refer to diabetes and prevention of diabetes and control of diabetes, we usually refer to type 2 diabetes. The third category of diabetes, the common diabetes, is the gestational diabetes, or the diabetes which occurs during pregnancy, the pregnant woman. These type of diabetes usually the patients usually recover once the childbirth occurs. However, they're again at an increased risk of developing diabetes in the near future if they do not follow the lifestyle changes which is recommended by the doctor. Now, coming to the most common type of diabetes, that is the type 2 diabetes. Now, as I have mentioned, this is the most common diabetes which is occurring nowadays. And this is the diabetes which is related to sedentary lifestyle, lack of physical activity, overeating, overweight, obesity. Some things which are in our hand, which you can control. Some things are not on our hands, like the genetic factors and other non-modifiable factors which we cannot control. But physical activity, diet, lifestyle changes, these are in our hands. And if we follow a disciplined lifestyle, then we can control or prevent the onset of type 2 diabetes. Lifestyle, diet, avoiding tobacco. Smoking is a very big health hazard. It is an important cause of heart attack, stroke, and atherosclerotic diseases, especially diabetes and hypertension. Smoking, tobacco is a complete no-no. Coming back to the risk factors for a type 2 diabetes, the patients who are overweight, as I've already mentioned, lack of physical activity, overweight, obesity, patients who have a family member, a first degree relative who is suffering from type 2 diabetes, patients who have hypertension or a high cholesterol level like dyslipidemia. Now, these are the risk factors for developing type 2 diabetes. Now, if any of you have any of these risk factors, you should go for a blood glucose testing, screening to know your blood glucose level. You might not be diabetic, you might not be, you may be a healthy person as well, but you might be suffering from a condition which is known as pre-diabetes. That is, your blood glucose level is higher than normal, but it is not as high as a person who is suffering from diabetes. And this group of people, if we follow a very good lifestyle, if you reduce your dietary calorie intake, follow a fixed exercise regimen, you can prevent the development or the onset of type 2 diabetes. Coming to exercise, at least 30 to 60 minutes of daily moderate to vigorous physical activity. You can go for brisk walking, you can go for jogging, you can play some outdoor games like badminton, tennis, or even at home, you can do some yoga, skipping, some aerobic exercises. Now we are spending some time at home because of the COVID-19 situation. Even the children are unable to go out and play. The physical activity has come down. They're mostly into online classes. They're forced to do online classes. Actually, children always want to go out and play. Now, these are tough times which we're going through, and this can increase the risk factors of developing such lifestyle diseases. So you can go for yoga, you can go for static exercises, you can go for exercises which can freestyle exercises which can be done at home. Spend at least 30 to 60 minutes for exercise daily. Dietary pattern can change. Now, we all like to have good food, we all like to have tasty food, but sometimes tasty food can be unhealthy. Limit your consumption of fast food, colas, cold drinks, burgers, pastas, pizzas. You can have them in once in a while, but not very frequently, especially those who are overweight and obese. Eat a lot of green vegetables, fresh fruits like apple, guava, sweet lime, papaya, pear, kiwis. These are the fruits which have low glycemic index, which have high fiber content and can fill your stomach, but at the same time, do not increase the calorie intake. You can also go for low-fat dairy products, increase the fiber content in your food, consult your physician, consult your dietitian for a healthy diet chart, which you can follow easily and again, maintain a healthy lifestyle. So diabetes is something which can be prevented with these small modifications. And those who have already developed diabetes, it's more important for them to follow these lifestyle measures. Always remember, medicines are not the first line treatment for type 2 diabetes. Diet and lifestyle changes are the most important first line management for all patients who are suffering from diabetes. With diet and lifestyle, after diet and lifestyle, whatever your blood glucose level is, it is then the pharmacotherapy or the medicine comes into play to reduce your blood glucose level to achieve a very good, a very controlled blood glucose target, which can prevent the complications of diabetes. Those who are diabetic, you should take your medications at proper time. Do not miss your medications. Monitor your blood glucose level frequently. Follow up with your physicians and follow the doctor's advice carefully. Go for routine checkups. Do not miss medicines. Again, tell you, medicines do not have serious side effects. High blood glucose can have serious consequences if not managed early. With these small steps, you can prevent the onset of diabetes. And if you are diabetic, you can control your diabetes to lead a disease-free life. I wish you all a very healthy life. Thank you.